All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is our third talk for today. Welcome everyone. Jenna is first, D. Diaz is second, then Carolyn is here, Westfield is here, Christy is here, and Susan is here. Susan, I saw your comment that you're very happy today, so congratulations. Shri is here. Welcome. Margaret is here back. Welcome, Margaret. And then all of a sudden a big scroll occurred. So Hot Chili Bean, hello again, welcome. Long time no see, huh? Hit the like button. Yes, Westfield is saying the right thing. So let us, so while we are, Barbecue Bean is here, hello. Let me share one more artwork with you, which I tweeted out. So if someone has not seen the tweets, this was the artwork I did over this weekend. So this is clouds on an evening sky. So I hope you like it. And with this, let's have our discussions. So the plan for the next week, so this week is merging into the next week in terms of work. Tomorrow I'll work with the conference from 5 till 10, 11. Then day after, the conference continues for another day, so 5 to 10, 11. There are great doctors that are in the panel that are coming in and talking. I'm so proud of hosting this and chairing this. I love it. And so grateful to Dr. Laurie, who has actually hosted it and arranged it, organized it, orchestrated it. So all credit goes to her. I am a chairperson. So that is excellent. On Monday, we'll have actually Dr. Tess Laurie with us in the morning time. So that is a convenient time for UK. So Monday, Dr. Laurie would be with us. Then Tuesday, I am in an interview with another ICU physician who is from New York, and he has his own channel and he wanted me to be there. On Wednesday, we'll have Dr. Fareed Jalali with us, and that would be, I think, an amazing discussion as well. And the week after then, we would have Dr. Corey join us too. So I think because of this extra intense work routine, what I'll do is, if you would be okay, next Friday, I will take an off and merge it with my weekend and kind of make it a long weekend. So with this, so Samina says that whether we can be registered in the conference or not. So Samina, they had tweeted out their conference registration page. Let me see if I can find it. I should have it here as well. So one second, I will have to open the PowerPoint to see if I can find it from there. So my apologies. While we are waiting, I hope you enjoy the the artwork. As you can tell, I'm so proud of it. All right, so when it opens up, we'll do some more discussion. Samina, I'll see if I can find the link and share it here. So let's see if there are questions. Doug has a question. I'm gonna stop sharing. My computer is. Do you have a voice before 6 a.m.? Consider warming up your voice before the conference. Yeah, so that is why waking up at 5:30 is the start of the backstage, as you can say. So I'm going to be singing in the shower to warm up my voice. So thank you, Doug. So George says, are there updates on J&J efficacy? So I think Johnson & Johnson's efficacy is the same. The update is that the pause is lifted and that would be resumed soon. France says, I'll go through bean withdrawals. So France, do you recommend not to take 3 days off? I am fine. I won't do it. So here, let's see. So this is kind of cheating on my end, but I think it is actually helpful for the bird conference, and that is, uh, here are some hashtags that we can use for Twitter. And this is important, Samina. So if you see here, Bird Group UK is the Twitter group. And below that, if you see birdgroup.org. And now that I'm showing it to you, please, if you would like to support them, there is the birdgroup.org/donate, where you can actually support them. And I think Dr. Tess Laurie and her team needs whatever help we can offer them. And what a bad thing that I was not sharing my screen. So let me share my screen. So if I go here and go to birdgroup.org, making sure. So this is the organization. I'm going to put that link here in the discussion chat as well. So this is the bird group. My computer is just so slow today. Ivermectin is safe. So here you have conference 24 to 25 April. If you go here, let me just remove these other tabs. And so here, this is the first international conference, overview of the conference, program, speakers. So yours truly is over here. And then I think over here, do you see this pink button on the top right? It says register. You can register from there. So this is the plan. So we'll start in the morning, and then Dr. Laurie would speak. Then we'll have more doctors who would speak. We would have questions. At the end of the day, I would summarize the days, and then the next day we would start again. And we look at the stars next day. Dr. Eli Schwartz from Israel, Dr. Corey. I think that there is Dr. Wasif Khan, Dr. Carvalho, Dr. Tina. So all great people. So that would be what is happening tomorrow. So I hope that this answers your question, Samina, that how do we become registered? Okay, so now somehow my computer is so slow. My apologies for this. I hope my voice is not breaking up. Okay, Gaurav Shah says, early steroids and blood thinners are being seen as the breakthrough we needed. Your take on it? So I discussed that this morning as well. I'm a tiny bit hesitant on steroids. However, the countries like India and Pakistan, I'm seeing doctors, they have formed a cocktail. The cocktail is very simple. On the day one, when the patient arrives there, that means a patient who goes to a doctor has symptoms, is worried. So it is not the day one of their infection. It is the day one of when they reached the doctor. On the day one, they are giving them steroids. They're now giving inhalers as well. We saw Delhi's AIIMS's protocol this morning that they have added budesonide for even at home, which is excellent. So the doctors are starting steroids, they're starting inhalers, they're starting ivermectins, they're starting either hydroxy or ivor. With that, they're giving doxy or azithromycin, and with that, they're seeing if the patient needs remdesivir or not. Most of the patients nowadays, they are figuring out to help outside. So that is a good news because we need this kind of a help. So Gaurav, you are correct that in the age appropriate patient, blood thinners will be needed as well. Or in the severity appropriate patient, which may be a younger patient but higher severity, blood thinners will be needed as well. Westfield says, I was bidding on the artwork. I have to put it up on NFTs. Some folks have asked me to put it up on NFT. I just do not know exactly how to do it. There is a question from Ner. Is it true that when doing trials on animals or mRNA vaccine, they would always all die? No. No. Who said that? So Machiavelli, you're correct. And I'm going to talk about that. So the first opening discussion after Dr. Laurie's welcome to everyone. First talk is by me, and I will be talking about the mechanism of actions of ivermectin. So one of these mechanism of actions is the ivermectin's in silico study of ivermectin binding with the spike protein and ACE2. Jacob says, I'm wondering if you have any thoughts to when FDA may authorize Pfizer for 12 to 15 for EUA. Has their phase 3 results been peer reviewed yet? Thanks in advance. So not yet, but I think that they are pushing for that. So we might see it in a month. I am not a proponent of that. So it's interesting. Let me put my position out there. I am pro-vaccine. I have gotten my Moderna. At the same time, I'm also pro-prophylaxis. I'm also pro every tool available that we can think of and hear of to try on us without harming ourselves. That is with doctors' guidance. I am somehow a little hesitant for younger children for the vaccination, but of course they would do a trial, they would tell us the results, and that is how the decision should be made. But if you look at how they lifted Johnson and Johnson today, I am so disappointed that the reason to say that we cannot explaining will be too hard. That is why we are not going to make it gender specific. Really, they should have done is simply said, don't give it to women. Finish. Don't give it to women. Finish. And now it has to be explained, and they cannot explain it. So put the women at risk. That is the answer to explaining it. And as you can tell, my voice is going to get me in trouble. I know it's going to do it, but this is the voice. So random guy says, I put a question. It was like 20 minutes ago. So I just started, random guy. I'm going to look at your question. I'm going to go try finding it. So let's see. Acoustic Theory is here after a long time. Hey, Acoustic Theory, how are you? So Samina, I'm working on that. Even today, I was looking at the data from Pfizer to see Israel to see if they have any data for pregnancy. They had one sentence for pregnancy, but I did not see the data. So that is on my docket. M. Gregory says, can you give art classes for COVID? Absolutely. If anybody would like to learn some computer language, so I can work with assembly, C, C++, Java, JavaScript, HTML, CSS as well, but not a lot. Swift for Apple. And if you would like to write SQL queries, I know how to do them. So I can teach this, plus the fundamentals of computer science is the architecture of a CPU and the architecture of a computer itself, and how the various buses, the data bus and the serial buses and other buses work, and how the switches work in there. I can teach that. I have been teaching MSc Computer Sciences, or I would love to teach art, although in art I am myself quite a beginner, but I would love to. Not teach, we do art together. Just like children sit down together and do art together, we can do it. Okay, so let's see more. So Dr. Bean is truly disappointing, but they wanted to give it to pregnant people. The Pfizer or Johnson & Johnson? I think in Israel, they have been giving it to pregnant women. We just need to figure out the data and discuss it. That data, I haven't yet found it, and time I haven't found it. So I'm going to random guy's question. I need to find that question. I'm sorry that random guy says he put the question up there. So on the way up, I'm going to just answer these questions. William, thank you very much for the super chat. Due to my situation, I'm only looking at guesstimates for risk reduction on one shot only. The reduction was 72% at 14 to 21 days, then 84% just 1 week later. Can I hypothesize it may further decrease even beyond 84% a little? Yes. There is no data. But if you look at UK, that has taken the duration between the two to 90 days and confidently did it and proved that they were right. I think that this is correct approach to see. The question is, what is the difference? Is it 84 to 85, or is it 84 to 95 or 90? That is not known yet. So I'm going up towards the random guy's question. So it would be great actually if you can put the question again, but I'm going to continue to scroll up to see if I can find it. And meanwhile, Rizobits, I see you after a long time as well, Rizobits. Question: is it true that India was giving out COVID kits with ivermectin and still they are having increased COVID cases? There was a time that when we saw that India had ivermectin being given out. The recent reports also are that ivermectin is being used. Somebody actually sent me a note saying ivermectin is being used like water in India. So the question is, why is it increasing? Those folks in my, the ones that I am in touch with, none of them were using ivermectin, the ones who became ill. One of my team member, and it is surprising that he's my team member. I talk about ivermectin so often, and I say to my team members that, hey guys, protect yourself, make sure that you have this. And him and his family all became sick and they were not using ivermectin. Then another doctor team member of mine, his father 65 became sick, then he became sick, father was even hospitalized, but they were not using ivermectin. So I think uh, ivermectin, as much as it is used, I population is still so large that it is not necessary that everyone is using it. Jan Elderton says, Dr. Bean, I hope you use your amazing drawings during the bird conference. Yes. So after this discussion today, what I'm going to do is I'm going to create some of the drawings for the mechanism of action. And then I especially asked them, I said, please allow me to draw while I'm presenting it. And they said, sure. So I will be allowed to draw as well. So hopefully that would work. So still going up, a random guy, preface your question with question. I think I may be reaching near. There's a random guy says, here, is this the one? How many times are you going to ask the same question? Is that a question from me? Um, let's keep seeing. Dishing the grind says, thank you for being positive, using some humor too. Absolutely. So Luffy has started doing something really annoying for my wife. What he has started doing is, if you could see, what my wife does is she loves to put these plants. So if I can show you these plants. So these plants are everywhere. For example, my table over here has 3 plants. And then there are some plants that are in water jars. And Luffy would come and he would pull the plant out and throw it and drink water from it. So she has 2 concerns: one, Luffy will become sick with that dirty water, and secondly, the plant dies. And so nowadays there is a back and forth going between Luffy and my wife. And I actually made a video today to send it to my wife because Luffy was doing the same things again at my table. Okay, so continuing with the, so let's see if random guy has put his question again. Otherwise, I couldn't find it. Wow, Andrea says that plant is named Jiboya. Thank you very much. I have a narrow window of knowledge, and that is for medical concepts, some art, business, and I love to play music and software engineering. This is my area, and that is all I am. Okay, here is a question. So random guy says, question, eye mask plus ivermectin prophylaxis for high risk individuals is 200 microgram per kilogram biweekly. I am 42 with average health and am vaccinated, not high risk. My doctor recommended only 115 microgram per kilogram biweekly. Is this enough? So let's see, what is the weight. So the most important thing missing here is the weight. So once again, I have said it every single time. I cannot provide a personal advice to someone. I can only tell you what is the right dose. Therapeutic dose is 0.15 milligram per kilogram, 2.2 milligram per kilogram, or as you write here, 200 microgram per kilogram or 150 microgram per kilogram. This is the therapeutic range, 150 to 200. With this, the frequency for therapeutic doses is 6 months, 6 months, 3 months, 6 months, and a year. Ivermectin has never been used, other than topical use on the skin, has not been used like this on a chronic basis. So that means what may be the side effects we do not know yet. So far, it has been very safe. It has been used in the world, and it is very safe as well. So 0.15 microgram, 150 microgram per kilogram is therapeutic dose, and it is safe. And it is the lower side, so that is fine as well. Okay. So we had to really find this question. So logic says Dr. Bean medical lecture. So these are the questions that are going to get me in trouble, right? As we saw that there is a guy who got, there's a chiropractor who got arrested, although he was selling things saying it is better than vaccine. So I hope I'm not saying that, but here, should I feel confident being safe from symptomatic COVID if I am on ivermectin? Is the efficacy comparable to a vaccine? So this is the statement that can get me in trouble. The study that they did in Egypt for prophylaxis was dose one, day three, and then monthly, but for 1 month, day one and three. And they found about 72% efficacy. So that efficacy is not like vaccine, which is 94%. Now, during the infection, the usage, there are many trials that have shown very good efficacy as well. So I don't know if I would like to compare it to a vaccine or not. I got my vaccine as well. So vaccine should be taken, but it has good, the studies show good efficacy. Sepal Steve says, did you get the chance to look at IL-33? Not yet. I am so sorry that I have all those notes taken down and then I'm still behind. Amit Kishore says, hello, sir. Anyway, you can know if we will develop blood clots even before taking the AstraZeneca vaccine. I'm a healthy male aged 31. So couple of things. Number one, it is not seen that commonly in men. For example, in the US, all the clotting cases, they eventually said in the news I was reading that they were 15. I think there are more than that, but they said they were 15. And they were all in women. So for the US, they said, we haven't seen this in men. So number one, the risk is already lower in men. Secondly, this age is also some age where I think the risk is lower, but the AstraZeneca's efficacy. So I was talking about, when I was talking about clotting, I was talking about Johnson & Johnson, not AstraZeneca. Still, the clotting occurred in the younger people compared to older people, but in women. So that is what they know so far. Now, the second part of your question, that do we know if this can happen? The answer is no, we don't. And that is the bad part of it. Even with the heparin-induced HIT therapy, heparin-induced thrombosis, they actually do not know who would react to it in the wrong way. This is just like allergic. So when some people are born, can we say that this person will be allergic or this person will not be? We cannot. It is a similar behavior of our immune system. But yes, somebody who had HIT before, they are probably more prone to it. And somebody who has this issue may get HIT as well. So if it is known, then that is a different thing. But if it is not known, there is no assay, there is no test to tell if this can happen. So Morehouse Joplin says, if your female loved one was in a country whose only COVID vaccine was J&J, you would tell her not to get it. Good question. And it should be a theoretical question or hypothetical question. It cannot be a question where I ask someone to ask someone, and that would be bad. Hypothetically, so let's say I'm actually thinking about my own wife as well. She's in the at-risk age group. And If there is a protocol for the vaccine to say, we'll give you the vaccine, third day, please come in for the platelet factor 4 antibody test. Sixth day as well, come back to do that test. Meanwhile, if you develop headache, blah, 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 you come back and we would test you. And if we found something, we'll immediately start you on the blood thinners. And if the doctor can look at her, see that she's healthy, can take blood thinners, and say, you know what, we are going to give you this vaccine and we would start you on blood thinners, start taking them from fourth day, and here are the rest of the protocol. If this protocol is in place, which is what I am asking for from the very first time that this news has started, if this protocol is in place, and I think there is protection. But if the protocol is not in place, then there is a lot of risk, and I do not know how to. For example, once again, if you see what CDC just said, they said 4 people said no, 10 people said yes. So majority said yes, but there is 4 people who said this is a risky business and don't do it. So if I was voting with them, I would vote with those 4 people. I would be one of those 4, or I would be 5th. So Zelena says, I would love it if you set up a Luffy cam in addition to you talking plus the illustrations. Absolutely. I think I can figure out some camera over here so you can see Luffy, lounging around and then muttering over here and pulling the plants out of jars and doing those things. Okay, so let's continue on. Acoustic theory, yes. Good to see you, Acoustic Theory. I hope you're well. Mr. J. Yes, for Luffy. Okay, perfect. Picture in picture, we can have that, yes. Amit Kishore says, question, just a thought, may be stupid or illogical. Can we take heparin and blood on an individual in a tube, mix it, and see if clotting happens? Will that be a good determinant of the clotting? The problem is that we need the immune system to become active against heparin or against its vaccine and produce antibodies. Then those antibodies should attack the platelet factor 4. Then they should sit on the surface of the platelet. Then the immune system should come and activate that, and the platelet should become activated, and the inflammation should occur, and thrombosis should occur. This all, number one, takes anyways from 5 to 17 days, number one. Mean is 9 days, 50% of the people 9 days. So one, we have to have an active immune system in that test. So you have to provide the natural killer cells and the other cells and the B cells and everything. Then you have to nourish them with these things for, let's say, 9 days or 17 days. Then you have to see that antibodies are produced and they're attacking. So a little difficult. If it has occurred, it is easy to find. But to regenerate that in lab, it can be, but it is a research process. Anna says, is there anything one can take to prevent blood clots after receiving the vaccine? How would you know if you have a blood clot in order to get treated ASAP? I did 2 important videos. One video is the signs and symptoms, and the second video is how will your doctor manage it. In the signs and symptoms, I hope I can put them all. If I miss something, please forgive me, and that means you please read the CDC site. Persistent severe headache, that is one. If we come down, eyes, blurry vision continuous, swelling of the eye, pain in the eye, disturbance with vision. So that is with the eye. So disturbance with eyes. If we come down, then nothing here. On the skin, petechial hemorrhages or bruising, new bruising and new petechial hemorrhages. If we go further down, lungs, shortness of breath that is continuous or that is persistent or that is bothering and has occurred 4 or 5 days after the vaccine, because it is possible that soon after the vaccine, the same day, we might start having headaches and lethargic and fever and other things. These are not antibodies. Antibodies are not generated usually within 1 day unless somebody was exposed before. So this is 4 or 5 days later. So shortness of breath. If we go further down in the tummy area, stomach area, so abdominal pain, which is persistent as well. I would add to that any black colored stools or any bleeding from the anal area or gums bleeding. These would also be the signs of the bleeding that is happening. What else? The pain in leg, persistent pain in leg, cold legs. These are all the signs of thrombosis and then bleeding as well. Now, what should a doctor be doing? I think that every hospital has a protocol from the CDC news that we were seeing. Maybe next week, and that would be very kind of them if they come together and they define a protocol to say this is a protocol after giving Johnson and Johnson. That protocol would, for example, if a patient is brought into hospital and all of these cases, headache, shortness of breath, leg pain, abdominal pain, persistent, severe, patient has to go to hospital. This cannot be easily treated at home or in outpatient. The patient might die. So and I showed a few days ago when I talked about it, Goodman Gilman book says when to hospitalize, immediately hospitalize, talk with the hematologist right away. So this is how serious it is. So in the hospital they usually give ergotroban and then they move the patient to ICU where they would do further blood thinning. Then it is possible they would discharge them on blood thinners, which may be rivaroxaban or apixaban or something other. But that all has to be very, very carefully seen because this in turn can cause further damage to patient. This is why I keep saying, make a protocol. A patient can be saved. Make a protocol. Make everyone aware of it. If you want to give the vaccine, give the protocol. Adding on the label that this carries a risk of clotting, so what? So if I'm a woman, let's say 40 years of age, and you're going to give me a vaccine, and you're saying, hey, this may cause clotting. So now what do I do? If I am insured, I can go to my doctor and say, what do I do? And if you see a few days ago, one of the cool beans here said his friend got the clotting, went to the hospital, and they gave her heparin, which is contraindicated in this situation. So the doctors themselves are not yet fully aware. So this is a mess. I hope, fingers crossed, that next week when they come together and talk about signs and symptoms and the treatment, they would lay it out correctly and create a protocol that can be used. If that happens, then I'm happy. Staples Steve says, hit the like button and smash the bell. Absolutely. Make Luffy happy. Luffy was talking in a few minutes ago as well. Thank you very much. Dead Ed says, I am male and I got J&J over 2 weeks and my heart have been burning and nipping. Very weird. Have anyone heard of this also? Sensation in veins of left leg. I may have COVID-19 last March 2020. So look, my wife had J&J as well. And so she had headaches, which were very scary. Today, for a few days now, she does not have headache. But today she was saying that my tongue, she had a eye that swelled up a few days ago. Today she was complaining of her tongue. So there are some things that are still going on. My recommendation, the best is to please talk with your doctor immediately, be on the same page. This is what it means to lift the pause from these things, to say the doctor should be able to talk about it and you should be able to talk with the doctor. So please talk with your doctor and find out what is going on. So P. King says, the problem with your protocol suggestion is that the hospital is already taxed. There won't be time for follow-ups if COVID is taxing. This is absolutely, you're correct. But the thing is, the thrombotic thrombocytopenia is not manageable in outpatient. Yes, IVIG, rivaroxaban, apixaban, aspirin like things are useful, but they can tip the patient on the other side as well. Patient is already in thrombocytopenic state. Now we're going to give them further blood thinners in a hope that the thrombosis would stop, and we can tip the balance even wrongly and cause more issues, and this would cause stroke and heart attacks. So because of that, it is important that this protocol is put together. If CDC comes back and says, you know what, the protocol is on the third day you start with the blood thinners, and you start them outpatient, you give the patient, you give them the injection, you give them the blood thinners, you say you get headache, talk with your doctor, and if he says yes, you start taking those blood thinners. Fine, that is a protocol that can happen. But people just taking blood thinners, they do not know the dose, they do not know what is the right amount, should they take it or not. So it is a serious thing. So science says, question, what if I got the first shot, then I caught the virus? Will the natural infection act as a second dose, that is a booster to reach the needed immunity? Ideally, yes. Ideally, natural infection is the full dose, full booster, whatever it is. Now, after that, if you get the vaccine, it's not going to be harmful either, because you already got infection and have the immune system. So immune system is going to look at that little drop of vaccine and say, so what? Ideally. Barbecue bean, gold country Russ, I have same situation with my PCP. I will stay with her for routine, but if you hint that I'm getting symptoms of Rona, we'll use FLCCC. Okay. So let's do a couple of more questions, and then I would beg leave. I would, of course, tomorrow and day after is the weekend, but I will be working and I will not be available. Next week, we'll go till Thursday. Friday, Saturday, Sunday will take off, if that is okay, and then we'll continue from there. So let me take one more question and then we stop. So Fizan says, do all virus insert their genome into the host cell nucleus? If yes, do they have to insert the genome by the reverse TRA like HIV? If not, then how does influenza or any virus takes over the cell? So when you say all viruses, now I have to talk about every virus family separately. I would just give you two examples. One is adenovirus, which brings the DNA into the nucleus. And the other one is the SARS-CoV-2, which does not bring the RNA or DNA to the nucleus. It actually has a messenger RNA. Now, how does it take over the cell? The virus's need is the ribosomes. Ribosomes are the machineries that are sitting in the cytoplasm. So if a messenger RNA-based virus or a negative sense RNA or a positive sense RNA virus comes in and only stays within the cytoplasm with the RNA, it would just use the ribosomes and make more of its proteins. And then these would be assembled in Golgi and then would be let out from the cell. So it's not necessary that every cell has to, every virus has to affect the DNA or go to the nucleus. So with this, thank you very much for being here. There were Doug says that column 1 in the table was unclear, asymptomatic infection. So Doug, if you can look at that link that I sent, and this diagram is in there as well, maybe we can do a discussion next week about it. Lizzie says, are the blood clots and low platelets only associated to the J&J vaccine? So the whole thing is muddy now, right? So AstraZeneca was the first. They said it's not us, this is just population, it happens. Then there was a German research that came out and they said it is related to the vaccine. Then there was a political answer to say, well, Germans really, and the UK and the Brits and Germans, and so Germans wanted to do this. Then a UK study came out for AstraZeneca and said, this is related. And I actually saw that study here and showed it to the Cool Beans as well, where they actually referred to the same German study as well. So there is some link with the AstraZeneca. Or if I boil it down further, there is some link of the adenovirus-based vaccines to this clotting. If that is the case, hypothetically, if that is the case, then Sputnik, AstraZeneca, Johnson and Johnson, and any other adenovirus-based vaccine should carry this risk. And Johnson and Johnson's document, the FDA briefing, I showed it a few days ago. I can show it again. Contains a text in there that says that we are concerned about thrombosis. So it looks like this platform has this known issue. Then there was another study from UK that came out and said, well, it's not just the Johnson and Johnson or AstraZeneca, Moderna and Pfizer has it too. And they said the difference only is 1.4 versus 1.5 cases of clotting in a million. So now today CDC said Moderna and Pfizer are not known to do this. So you can see that there is a back and forth between messaging as well. I think people should just know what is the right answer and what is the right protocol and go from there. So with this, Logic says, Dr. Bean, medical lectures, thank you. I think you should create a how to code series just like your medical series online. You're a great teacher, very knowledgeable, drawing self. Thank you very much. And Logic, I have actually written 2 books about 20 years ago. One was the fundamentals of computer sciences, and the other one was how to write SQL queries. So I love computer sciences. All right, guys, thank you very much. Please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. One is if you don't want to use PayPal, you can buy me a coffee. If you are okay with PayPal, there is a link there as well, or you can be a patron as well. So thank you very much. And I have one more. Rubies are red here. Thank you very much for the super chat. Text is my question on immunosenescence in 70 plus group and how that age was grouped with children in tonight's video. So I haven't looked at their exact data. They actually have the data model, a table. So let me just very quickly show it to you. 1 second. So if I go here, and then if I go down to this page, this is one table, and you can actually download the PDF to see it. But if you see here, characteristics, median age group, there's 16 to 39 years, unvaccinated group and vaccinated. So they have this breakdown of the people who were participant in this. For example, on pregnancy side, 1,508 on pregnancy side, pregnant women, and 1,508 non-vaccinated pregnant women. So they have this data. So now if I look at the question on immunosenescence in 70 plus group and how that age was grouped with children in tonight's video. So if you see here, let's look at the age group. So 16 was their lowest age. So 16 to 39 was the group. So that means everyone, teenagers and up to 39. And then for 70, they had a slot 60 to 69, and then 70 to 79 and greater than 80. So I hope that answers that question. I hope that I understood that correctly. Otherwise, we can take it up next week as well. Ranjan Kumar says, hello, sir. Is it true that second wave always causes that much of surge and deaths? In past, same with Spanish flu, that second wave caused maximum damage? If yes, why? I think the second wave is really the absence of a control and then people just meeting again. Think about it. This is a respiratory virus. If everyone just sat at home, it will not go anywhere and it would finish. So the spread is because of mixing and mingling and being close to each other. And we are humans, actually humans, animals even, they like to be with each other. They like to be in herds. So it is not a bad thing that we want to be together and we want to be with each other. It's a good thing. But this virus takes advantage of that situation and spreads with that. So second wave is usually, so in our cases, the second wave is because it is a variant. People are tired for a year now. They're just doing their daily activities and they get stuck. Every country has a different reason. But there is, other than variants which are spreading faster, there is no other thing to say second wave has to be more dangerous. Cool. So people stop mingling. Yes. We should mingle on Zoom. Um, Rubies and Red says that I have tweeted some really cool research document to you on Twitter. Cool Beans will love it. Thank you very much. I would check this out. So once again, thank you very much. If you would like to support this work, there are links in the description, and I would see you all on Monday. Monday morning, 9 o'clock, Dr. Tess Laurie will be with us. Thank you. Bye-bye.